Distinguished delegates, an esteemed speaker, on behalf of Hetero Healthcare, I welcome you to this scientific initiative with latest advancement in allergy diagnosis, treatment, and management strategies. This program is designed in advancing the knowledge of clinicians across diverse specialties within the field of allergy management. Today's event is live streaming to two other venues at Mumbai. So, myself, Simantini Paja, along with my other colleagues, welcome all delegates at Hotel Satka Residency and Hotel Kohinoor. Before going ahead with this program, let's take blessings from Almighty with lamp lighting ceremony. So I'll request our esteemed speaker, Dr. Sitesh Roy, Dr. Prashant Khandeparkar sir, and Miss Veena ma'am, Mr. Puneet and Mr. Nikhil to come forward, and Monohar ji, of course, for the lamp lighting. Mr. Bala also, please join us.
वक्रतुंड महाकाय सूर्यकोटि समप्रभा निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा ओम नमो नमः श्री सिद्धिविनायक नमो नमः अष्टविनायक नमो नमः गणपति बप्पा मोरया मंगल मूर्ति मोरया ओम गणपति नमो नमः श्री सिद्धिविनायक नमो नमः अष्टविनायक नमो नमः गणपति बप्पा मोरया मंगल मूर्ति मोरया ओम गणपति नमो नमः श्री सिद्धि विनायक नमो नमः अष्ट विनायक नमो नमः गणपति बप्पा मोरया मंगल मूर्ति मोरया ओम गणपति नमो नमः श्री सिद्धि.
On this special occasion, we'll take this opportunity to share brief about our organization, Hetero Healthcare, with a short video.
At Hetero Healthcare, we are committed to improving lives. For over 30 years, our journey has been driven by one purpose: to enhance the quality of life through continuous innovation and advanced healthcare solutions. Presence in 126 plus countries with 36 state of the art manufacturing facilities. Backed by a century's worth of experience, our team relentlessly pursues excellence. We aim to improve the people's quality of life with a wide product range encompassing multiple specialties and continuous research and development process with 1,000 plus top-notch scientists. We are more devoted to finding tomorrow's cure and the treatments for some of the most critical diseases. Over 2 decades of experience in developing APIs, among the largest manufacturers of ARV, APIs, and FDFCs in the world, is a testament to our commitment to high-quality active pharmaceutical ingredients, pushing the boundaries of healthcare solutions. 21,000 employees working globally. In just few years, we introduced 4 groundbreaking, 300 plus products, 314 formulation, distinction of bringing 4 biosimilar products to market within 5 years of initiation. Darbepoetin Alpha, Rituximab, Bevacizumab, Adalimumab, and 360-degree solution provider, revolutionizing treatment for millions. Our product range spans multiple specialties, from antiviral medicines to pioneering innovations like Fluivir. During COVID-19 pandemic, Covifor, Remdesivir is our contribution to serve country and humanity, instrumental in the fight against COVID-19. Our achievements are recognized globally. Won Express Pharma Excellence Award for COVID-19 drug launch, rewarding our contribution to provide Covifor, Remdesivir access to more than 1 lakh patients. Largest manufacturer of HIV drugs, largest manufacturer of antiretroviral drugs, manufacturer of wide range of anti-cancer drugs. Our commitment to innovation goes beyond healthcare. In June 2023, our sister company, Azista BSD Aerospace, proudly launched its first microsatellite, marking a new milestone. As doctors care for their patients, We Care for You initiative fosters a unique bond of trust, offering support not just through products. We Care for You is not just an initiative, but an emotion committed to you and your paramedical staff. Hetero Healthcare is committed to a healthier world for everyone.
Now I request Dr. Prashant Khandeparkar sir to introduce our esteemed speaker.
Thank you, Martini. Good morning and a big hello and warm welcome to all of you once again. This scientific program is on complete guide to allergy management. Allergy is something which affects every organ and system. You'll agree with me. In fact, someone has rightly said, everything under the sun, including the sun, can give allergy. And to know more about allergy, the objective of this program is to empower clinicians with latest developments in the field of allergy. And this program is a 12-module program discussing latest developments in allergy diagnosis and treatment. This scientific initiative is facilitated by renowned immunopathologist and allergologist, Dr. Sitesh Roy. Good morning, sir. Welcome. Dr. Sitesh Roy is MBBS, MCPS, MD, FAAP, FAAAI, FACAAI, US Board Certified Allergist, Immunologist, and Asthma Specialist. Dr. Roy is founder, Dr. Roy Health Solutions, Mumbai, ex-associated professor of pediatrics and medicine, and director, Jackson Medical Mall, Allergy Immunology Clinic, USA, 2002 to 2010. Dr. Roy has got fellowship in allergy and immunology at National Jewish Medical and Research Center of University, Colorado, School of Medicine, Denver. Fellow of American Academy of Pediatrics, American Academy of Allergy, Asthma and Immunology, American College of Allergy, Asthma and Immunology. Sir is diplomate at American Board of Allergy and Immunology, listed amongst best doctors in America 2005, 2006, 2007, 2008, 2009, 2010, 2011, 12, and Guide to America's Top Physicians from 2005 to 2010. Dr. Roy is author of original articles and publications for leading medical journals internationally and textbook chapter on stress and allergic disease in Psychoneuroimmunology textbook, 4th edition. Welcome, Dr. Sitesh Roy. Welcome once again. And I hand over the proceedings to Dr. Roy.
Thank you very much, Dr. Khandeparkar, and a warm welcome to all my colleagues. Thanks to Hetero Healthcare for planning and organizing this program. Gives me great pleasure to initiate the first two of this 12 module series, which, as you will see, is a build up on what we know about allergy, taking you to a next level of understanding. I'm sure that all the practitioners, those who are sitting here, or our colleagues at Satkar Residency or at Kohinoor will all agree that almost 30 to 40% of your practice, if not more, is allergies today, or allergy-driven diseases, as I may call it. So as I begin this, because this is a field, as you will see, and I do my presentation, I've actually been given an hour and a half. I'm going to try to complete in 1 hour so that we can then have half an hour for your questions and answers. But I begin by this very interesting conversation between Albert Einstein and Charlie Chaplin, where Albert tells to Charlie, "What I admire most about your art is that you don't say a word and the rest of the world understands you." And Charlie replies back to Albert, "Your glory is even greater. The whole world admires you even though they don't understand a word of what you say." He was obviously talking about the theory of relativity and everything else that went with it, which was really bouncers at that point of time for the world. When in reality, when you look at relativity very carefully, it has been described in our ancient Indian texts thousands of years ago. With that, on a lighter note, I begin my presentation. What I will do today is I will take you through a journey where, so I have spent now about 24, 25 years of my life in the field of allergy, dedicatedly, exclusively allergy. I am a pediatrician by training, but when we go into allergy immunology, you do adult and pediatric training, and you get board certified for that in America to see kids and adults. So now I do what is called womb to tomb allergy. Okay, so from pre-birth, mothers coming to me saying, "What can I do to prevent allergies in my child?" to very elderly individuals who are suffering from chronic urticaria or drug allergies or very, very interesting manifestations, which through the 12 module series, I will share a lot of cases with you all. Today's lecture is more focused on a pathophysiologic mechanism and also understanding why allergies are increasing. These are very common questions that you all will receive in your practices from parents. Do understand that everything can't be covered in every part of the module. So there will be, it may seem like there are things that could have been covered, which will be covered in the subsequent module. So this has been designed as a series of lectures, which as you keep attending, you will really get a very in-depth understanding about allergy, immunology, asthma, and all of that together. So why are we even here today? Okay, on a Sunday morning when we could be doing so many other things with friends, family, and personally, the reason is that allergy is increasing worldwide. And when I say it's increasing worldwide, we're talking about a 300% increase in allergies in India in the last 2 decades. We're talking about anywhere from 20 to 40% of the world population being affected by at least one allergic disease. And I'll go through the list in a short time. And the fact that allergies start very early in life. The youngest child that I have ever seen saw me in the first week of life with pretty severe atopic dermatitis. Okay. Now you would think that where's the time for sensitization and then allergy to develop and everything else? But the reality is that allergies can begin very, very early in life. And there are very interesting studies that even find specific IgE to different substances in the cord blood of a baby at birth. Okay. So these are very interesting topics that we shall discuss in today's lecture. As we can expect, the young patients that we see, the children, the teenagers, the infants, the toddlers are the ones that are most rapidly rising when it comes to allergic diseases. And they're going to grow up, and allergies are chronic diseases many times. Atopy is a genetic predisposition. So they are going to go on to be adults with allergies and other related diseases. And in this, what we have come to realize through many decades of research is that diet, lifestyle, environmental factors, stress, all of which I'm going to present you with today, because that's how we can really get to the understanding of the etiopathogenesis and the rise in allergies that we are seeing in today's day and age. And understanding that at the root of it all is stress. Okay. And I'll speak more about it later in my presentation. So when we talk about the broad scope of allergy, as you can see, right from atopic dermatitis, which begins very early in life, as we know, we estimate that there are over 100 crore people with atopic dermatitis worldwide. Nasal allergies, 50 crores affected worldwide. Asthma, 30 crores. Food allergies, 35 plus crores. If you include food intolerances, probably the numbers would go even higher. Ocular allergy, drug allergy, insect allergy, anaphylaxis, including life-threatening allergies, allergic contact dermatitis, acute and chronic urticaria, eosinophilic disorders. So my field is very interesting because it dissects into what a chest physician would do. It dissects into what a dermatologist would do. It dissects into what an ENT surgeon would do. It dissects very much into what pediatricians would do. It dissects into what a gastroenterologist would do. And very interestingly, in my practices, both in America and here, I have quite a few referring physicians who are from these specialties who have come to realize the importance of a multidisciplinary management for some of these patients so that they can get optimal results in their disease control. So before we begin, it's very important for us to understand that what is it that the immune system does? If I were to very simplistically tell you, as I told you, my passion and love for immunology actually began in second year of MBBS. Most people ignore that microbiology portion of the textbook that goes into immunology. It was my favorite. And even when I was preparing for my USMLE exams, I think probably the immunology textbook was the only one that I read twice. All the others I may have read once or so. But the basic thing that the immune system does is it differentiates self from non-self, something that it considered its own versus something that is not its own. This is a very simplistic but a very, very broad example of what the immune system does. Now, I'm not going to go through all parts of the immune system because it's gotten way more complicated now than it was even 25 years ago when I trained. And it's not worth getting that much into detail, but I will pinpoint and highlight certain key features of it. So the immune system is supposed to keep invaders out, whether it's bacteria, viruses, fungi, parasites. And obviously, when it starts reacting to allergens, which are not really invaders, it becomes a problem. And then keeping the abnormal cells that are being formed, whether they are cancer cells or whether it's a transplant or a graft, we know wherever there is a non-self recognition, the immune system will activate and react against it. Now, recognizing this, there is a difference between what we call immune tolerance and immune intolerance. You can think of immune intolerance as either allergy or autoimmunity or hypersensitivity, whichever way you want to look at it. And tolerance would be where you live happily in acceptance of the environment, the food, and everything else that is going and your body is connecting with. And that's where a balanced immune system, and hence I show a meditative cartoon there who is very accepting and recognizing of whatever is around without fighting against it. So if we were to look at allergy again as a definition, it's an adverse immunological reaction that is developed towards harmless substances in our environment. The word harmless is very critical here because when we say harmless, what we mean is that it's milk that a baby is supposed to tolerate. It's, a house dust mite that has lived around us since thousands of years. It's a pet dander that has been again in contact genetically with our immune system for hundreds and thousands of years, and yet our immune system of the person who's allergic responds to it in a very angry or aggressive manner. Antigen is the substance that you become allergic to. Antigen itself is not an allergen. So I don't like the word allergen because allergen would mean everyone should react to it. It's actually only an antigen. An antibody is obviously the substance we make, and you have to get sensitized before you become allergic, which we will see in the following slides. The word allergy originates from two Greek words, allos and ergos. Allos means a different or changed reaction. Ergos means work or reaction work. So when you have an altered response to something, you're basically becoming allergic to that substance. Hypersensitivity by itself means that something very innocuous and harmless in the environment is being treated as an enemy. And generally, most allergens or antigens are glycoproteins. Very rarely will you have only a sugar moiety acting as an allergen, and it usually has to be haptenized or bound to some protein, even if it is internally, before it does that. So you can think of an allergy. I always explain this to my patients. It's an overactive and overzealous immune response to something that you should not fight against. It's clearly self-damaging because whichever organ it occurs in, it causes harm. And it's due to a failed immune balance. Now, this word is the key. It's what I would call the holy grail of every disease that you and I know as physicians or human beings. Because in every single disease, right from getting a heart attack to developing cancer to developing diabetes, type 1 or type 2, somewhere or the other, this natural balance or homeostasis of the body is disturbed, and hence you go from ease to dis-ease. Okay. And this immune balance is what we're going to talk about today. And as you can see in this picture that's at the side, that we are talking about a type 1 and a type 2 response. This is T helper 1, T helper 2. Cellular immunity, humoral immunity. Cellular immunity, you can see the damages that it can cause if the Th1 goes high, and if the Th2 goes high, all the typical allergic and inflammatory diseases would occur. So autoimmunity on one side, allergy on the other. When I was training, we were taught that a person can have either one or the other. Okay. Times have really changed. In the last decade, I have seen bunch of patients who have a full-blown roaring autoimmune disease and also have allergies, okay? Whether it's to drugs or foods or other substances. So clearly, our theories change over time, just like our theories about cholesterol changed over time, right? What we heard 20 years ago is no longer true. And we realize that it's really the balance that's an issue. It's not whether it's all Th1 or Th2. It can go either way if the balance or the regulation is off. And that regulation is shown here in a very simple way, where on the top you can see that when a dendritic cell or a macrophage, which are presenting antigens to the immune system, because they are present in our airways, they are present in our skin, they are present in our digestive system. They are the first contact people. They are our innate immune defenders, you can think of, and also presenters. When they present the cell, there's a choice for the T helper cell to either take it in the Th1 way, where the physiologic role of Th1 would be to fight intracellular pathogens. And if the Th1 goes haywire, then we develop autoimmunity. Same way, if it takes it down the Th2 pathway, then we develop potentially, so that's how we fight parasitic worms. It also has a role in fighting viruses, Th2. So it's there in our body for a very good reason. And we, being of Indian origin, we have much higher IgE levels than other people in the world. Our average IgE level is closer to 200 than to 100 or 150. That would be typically said in the reports. And you'll see some reports even saying 398. I disagree with that. If you're at 398, you're probably a bit too high. But the reality is that we do make more IgE because our genetics has been geared that way, because we had high parasitic loads growing up, or in our genes, our ancestors have seen it. Now, when that part of our immune system is not getting triggered, fortunately, I'm not saying we should all give worms to the children before so that their Th2 does not get converted into allergy. They have actually done research on that, and we can talk at some point about it, whether giving parasites would take people away from allergies. It didn't really work very well. That system was too simplistic for it to work, because it's not just parasites. There are many other things in the environment that you will see that I'll present that actually determine whether your immune system is going to respond in an allergic manner or not. But right from having this deviation towards the T helper 2 pathway, where you then start reacting adversely to substances, and with this presentation, you will see the subsequent roles. But I wanted to let you know that the Th1, Th2 pathway have obviously very important roles in the body, and these roles are very well defined and determined. And when that balance goes off, and the Th0 that is in the middle, which is what most of the T helper cells are in the beginning, get converted to one or the other, we get a certain response. A very simple example here would be a baby that's drinking mother's milk. Mother is eating a bunch of different foods. All of those food proteins are excreted into the mother's breast milk. Okay. Now, when that food goes into the baby's gut has two choices. Okay. Either I tolerate it or I fight it. Okay. The tolerant reaction would be a Th1 reaction, which leads to production of IgG, immunoglobulin G. And the Th2 response would be where it makes IgE, which is the allergic antibody. Now, there's a myriad of factors that we shall talk about which determine whether that baby's immune system is going to go Th2 pathway or Th1 pathway. But the default pathway is Th1, where you develop immune tolerance and you make what is called immunoglobulin 2 and immunoglobulin 4, which are our tolerant immunoglobulins towards those substances. Now, imagine this with every single protein that the baby gets exposed to from the time the baby is born. So even as the baby is coming out of the mother's birth canal, it's getting exposed to different bacteria, different fungi, cells, and then coming out, starting to drink milk, through the milk getting all kinds of food proteins, environmental proteins, contactant proteins. And every single time, the immune system is required to make a judgment. Do I tolerate or do I fight? Do I tolerate or do I fight? So if you have a fighting tendency, you end up with allergies. If you have a tolerant tendency, you end up with a healthy, happy child. And there are many factors. Means this is just the beginning. You will see how deep the rabbit hole goes in just a second, in a little bit. I'm not going to bore you with too much of these, but this is a very important slide if you're understanding that, when the antigen presenting cell comes, there are different triggers to the immune response. We always say that in allergy, there is something called a two signal theory. Okay, never anything happens with one signal. There's always a second signal. And so if there is a bacterial, viral, fungal, parasitic infection, there are some toxins in the environment, the food peptides that the child is consuming or the adult is exposed to, allergens, medications, autoantigens, all of these together, along with what is happening in the body of the person, will determine whether you will go down the T regulatory and balance pathway. Will you go to Th1 or Th2? Again, the T regulatory cells are the most important cells in some ways, along with the entire spectrum of other cells and cytokines. Like has been mentioned here, if it's an interferon gamma and TNF alpha, it is more towards IL-12 and interferon gamma, it's more towards Th1. If it's more IL-4, IL-2, IL-13, then you're going towards more Th2. So these are all relevant and important because whether you like it or not, biologic therapies are being developed and biologic therapies are looking at targeting these molecules. And it's important for us to also realize that if our basics are clear, we would know when to think about these things. Now, I put this up here as IgE as the mediator of allergic disease. Remember that I'm focusing on IgE mediated disease, but there is also immune complex disease, which is mediated by immune complexes of IgG. There are complement mediated and immune complex diseases, which is type 3. Then there is type 4, which is all cell mediated. But when we look at IgE, the good side of IgE, as I said, it fights parasites and viruses. The bad side, it causes allergy, and the really ugly side is when it causes anaphylaxis, which can take the life of a person, whether it's to a drug, a food, an insect sting, or to another environmental allergen. And understand that this IgE molecule is produced from the 8th week of gestation. Even before the heart has developed, your immune system is already making IgE, okay, in the body. So as we can see that this is a very, very core issue. And if you look at the entire pathophysiology of an allergic reaction, the first step is where you get exposed to the allergen. And remember, you have all the wrong second signals, okay? The first signal is the protein. The second signal is whatever is in the inner and outer environment of that living being, a child or an adult. I see a lot of adult onset allergic rhinitis, adult onset allergic asthma, adult onset food allergies these days. So this is at any age group, not just in a baby. So first exposure, you present the antigen, and if you get a Th2 pathway triggered, then what you do is you end up through IL-4 and IL-13 or IL-12, you activate the B cell. The B cells then produce IgE. They convert into a plasma cell, make IgE. This IgE goes and binds to the mast cells and basophils. And on that, whenever the antigen comes back the next time, there is cross-linking of the IgE on the surface of the cell. And that leads to the release of what is called preformed mediators, which include histamine, leukotrienes, prostaglandins, and then you have delayed responses where you keep making mediators and you invite other cells into the environment. So you'll invite the eosinophils, you may invite the neutrophils, you may invite more macrophages, and with all of that, you will end up with a bigger reaction, what is like the late phase or delayed allergic reaction. And I'll go over this with each disease process so that the etiology makes sense to you of what's happening in a human being's body when they're exposed to it. But this is the basic bottom line. And again, why is this relevant to us when we practice allergy? Is because when you're doing an allergy skin test and you're placing the allergen or antigen on the person's skin and you're doing a prick through it and you're introducing it inside, whatever is bound to the mast cells in the skin, okay, in the epidermis of the skin, cross-links and immediately gives you a wheel and flare reaction, okay? Whereas when you do a specific IgE blood test, and this will come in much more detail when we go into each disease in the module, you will realize that that leads to binding to free-floating IgE. It is not detecting IgE that is bound to a mast cell or a basophil. So according to some people, the clinical relevance of a skin allergy test is a higher bit than what you would see with a blood allergy test. Both are very good. I utilize both in my practice, but this is a classic example. If you had IgE floating in the blood, which you were detecting, you don't know whether that's going to actually go and create any clinical symptoms when the person is exposed. Whereas if you have something that shows up on a skin test, you know it's cross-linking and giving you problems. It is still a sensitization. It doesn't confirm an allergy even on a skin test, but the clinical relevance becomes higher when you're looking at a skin test versus a blood test. This is a kind of idea of what actually goes on once that cross-linking of the IgE happens. When the cross-linking happens, you have these, as I said, granule contents, immediate release, histamine, TNF-alpha, proteases, heparin, membrane-derived lipid proteins like prostaglandins and leukotrienes. This is over minutes. The first one is immediate. And then you have the cytokines, which bring in all the other cells into that area and give you what is called the late phase allergic reaction. So the first phase happens in minutes and the late phase happens in hours. It's still the same process. And imagine this going on in the body of a person who, for example, has a house dust mite allergy on an every single day basis. So then there is very little differentiation between what is acute and what is chronic. They're always in that phase. So much so that if you focus on this, what is under the granule contents written as TNF alpha, TNF alpha is one of those substances that is released in our body when we get a very bad viral infection. Okay, so during COVID, during flu, TNF alpha is what gives you the fever, the body ache, many of those symptoms. So people with allergies literally can feel like they have a low grade flu every single day of their life if they have severe allergies. And I have patients who come like that to me. No energy levels, always fatigued, body feeling warm, always tired, not able to live the life that they know they can live on an every single day basis, sometimes for 10, 20, 30 years history they have, where they have intermittently just been treated with antihistamines or nasal steroids or oral corticosteroids, but never given chronic therapy. So if there is nothing else that all of you all would take back today from this session, I'm sure you'll take a lot more than that, is that allergies are a chronic disease. These are not episodic diseases as you and I were trained to treat them. 1 महीना दवाई लो बंद कर दो, 3 महीना दवाई लो बंद कर दो, देखते हैं क्या होता है. That is not how you treat allergies. Okay, allergies are designed to be treated on a chronic and long-term basis. Now, there are some that do go into remission, don't get me wrong, and there the medications stop. But if you have a fairly long history and you have a fairly long track record, testing that matches, clinical correlation of the testing, then you can know that this person is going to have some issues on an ongoing basis. And whether you manage it only with allergen avoidance, or you manage it with drugs and allergen avoidance, or with drugs, allergen avoidance, and immunotherapy, is something that you have to decide. That's not something that I could tell you today. But the point being that allergies are a chronic problem, okay, in most cases. Now, when we look at the mechanisms of allergic diseases slightly differently, why I put this slide on here is that you have to realize that some things happen systemically and some things happen locally. And some things are allergen specific and some things are allergen non-specific, non-allergen specific. And in these non-allergen specific mechanisms, for example, there is a subset of people who get chronic urticaria who make an antibody against their own Fc epsilon R1, which is your IgE receptor, your high affinity IgE receptor. In these people, there's no external allergen that is triggering them. And they're getting hives and rashes and itching, and their sleep is disturbed, and they're having trouble almost on a daily basis. But you can't find any allergy when you test them either on skin or blood. And many come to me expecting to find something, and once in a while we do, because it's not like it's zero. But chronic urticaria is a classic example where there are a lot of other what I would call non-allergen specific triggers that are there that lead to the same symptoms that you would expect with an allergic reaction. And so allergy gets more and more complicated. And when you look at the allergen channel, the sensitization occurs, you get the channel, you go down the signal to the immune system, you have the mediator release. Then depending on whether it's a local reaction and you're getting like an eczema, or you're getting an allergic rhinitis or an allergic conjunctivitis or a contact allergy or a food allergy, or you're getting a systemic reaction like a food allergic reaction that's all over, or you're getting a fixed drug reaction which is not IgE mediated, but it's cell mediated largely, but it's a systemic reaction. It can occur far from the site of the exposure of the antigen. And the funny thing about allergies is it doesn't affect everyone in the same way. One person can have a different manifestation with the same allergy, and another person can have a different manifestation. The classic example is when we see with house dust mite, somebody has only ocular allergies due to house dust mite. Another person has atopic dermatitis and itching. Another person has rhinitis. Another person has asthma, and have patients who have all four. Okay, lots of them. So question comes up, but the sensitization has occurred, the allergy has occurred, the Ig is there. Why is only one organ system affected? This is something that I call maybe even a three signal pathway, where what I call the weakest link, or which organ system was prone at that time when this occurred, that's the one that manifests the disease. And when this manifestation changes, what you and I know as the atopic march, it can go from an atopic dermatitis and a food allergy to an allergic rhinitis and an asthma in the same person. Okay, different organ systems, same allergen, different manifestations. I just had a girl in my practice a couple of days back, had really bad urticaria during COVID, had a few allergies, but really no manifestations of allergic rhinitis or asthma or atopic dermatitis. And we treated her for chronic urticaria. She also needed some neurological medications because she had a very strong post-COVID, long COVID syndrome. She got better completely, saw me after 3 years now, and she's got severe allergic rhinitis right now and mild persistent asthma, which she had absolutely no evidence for because I screen all my patients 3 years ago. just within a span of 3 years. So it's one of those things that she had the dust mite allergy when I tested her then. Sensitization, I would call it, probably, not allergy. No manifestation. I know that the chronic urticaria and the dermatographism is not due to dust mite allergy, but now she's got that, and that's what she's manifesting with symptoms. And the entire she has seen 6 doctors before seeing me again. It took them that long to think that maybe we should go back to Dr. Roy, where she has been treated for everything and even told to the point that you need a surgery on your nose because it's not allergic. When in reality, what she's going through is an allergic problem. And it was detected 3, 4 years ago, but wasn't manifesting then, but now is. So understand that allergies are a very evolving phenomenon. It's a very live system. Something can go into remission, something can come up. I have heard this story so many times where mothers will tell me, or fathers will tell me, or patients will tell me, sir, eczema था, eczema का इलाज किया, उसके 1-2 साल बाद राइनाइटिस चालू हो गया, फिर राइनाइटिस का इलाज किया, वो ठीक हो गया, बाद में अस्थमा चालू हो गया. And the funny thing is that the root cause has never been treated with immunotherapy to desensitize that person. Okay, so the manifestation is shifting around, and it doesn't happen to everyone, but this is very much something that we see in our practices. Another very classic example is you start with atopic dermatitis in infancy and toddlerhood. You outgrow it by age 3 to 5. And later on in life, you get hand foot dermatitis. The risk is much higher in people who had atopic dermatitis in childhood. The pathology is the same, the mechanism is the same, the location has changed. Okay, the occupational sensitizers have come in, and it's a completely different manifestation of the same underlying, what I call, atopy or genetic tendency or inherited tendency to develop allergies. So from here, we kind of start into that journey of what are the risk factors for allergic diseases. Now, I have actually created a small list. The list is even longer, and I'll present it in other parts of my talk today. But the family history, the genetics, okay, is important. The season of birth. We see this more obviously in Western countries. Like if a child is born in the month of November, December during winter, and they get RSV and they get rhinovirus, their risk of wheezing and having problems goes much higher. Gender, we typically think of wheezing as a problem of young male children, and then as they outgrow it, they get older, their lungs become bigger, their immune system matures, it becomes a disease of girls and young women when they hit puberty because of hormonal changes. We see that with many other diseases. Increasing pollution, we'll talk about that, dietary changes, obesity, changing microbiome. This is the future. Skin microbiome, nasal microbiome, lung microbiome, gut microbiome. We have bacteria everywhere. You've probably heard this by now, being in the field of medicine, that we have more bacteria and yeast cells inside our body than we have our own human cells inside our body. Okay, and it's a fact. Several trillion more of microbiome we have than we have of our own cells put together. Viral infections, big trigger, and then stress, which is my passion and love, and I'll talk about it later. So when we talk about some of the environmental factors that contribute to allergies in India, if we divide them into potential allergens and irritants or pollutants, you can see this list on the allergen side is all the typical things we think of, house dust mite, cockroach, molds, pollen, animal dander, medicines, drugs, insects. And on the irritant side, we have all the air pollutants, smoke, fumes, biomass, incense, strong odors, nitrogen dioxide, sulfur dioxide, ozone, tobacco, diesel fumes. The list is very long. But at the bottom, what I have written is the key: westernization of diet and lifestyle and affluence. All these promote allergy. Okay. And I'll present some data related to that. And we look at the risk factors for asthma, we get the same kind of things that are there: the genetic predisposition, atopy, airway hyperresponsiveness, race, ethnicity, and a few other factors are added like socioeconomic factors, occupational sensitizers. Now, this is kind of a composite of what I have presented so far, where in the environmental factors, you can call it the epigenetics, and the environment that is seen for non-atopics versus atopics. You will see that in developing countries, so India was amongst the lowest in incidence of allergy in 1997 when the first ISAC study was done, International Study of Allergies and Asthma in Children, ISAC. Okay, it had a phase 1 lowest incidence, like in the lowest 10 countries, okay, out of 100 and some countries. I think it was 110 or 20 countries. And within no time, when Isaac 2 came out in 2013, 2014, we have jumped up to the top 20 in the world. Okay, that's the speed with which we went up. And a big part of that is we went from many parts of India being a developing country to being a westernized country. Okay. And from living in joint families to nuclear families, so family size, to being in rural homes living with livestock, to living in affluent urban homes with ACs and extreme cleanliness. I'm not saying that cleanliness is bad, extreme cleanliness is bad. And what I mean by that, I'll define later. Our high antibiotic use, okay, our level of parasitic infections. I'm not saying we want them back, but it does modulate the immune system early in life. And then the high orophycal burden. Again, this is a very tricky situation. I'm not going to go and say that we should not have good sanitation, but the degree to which we are doing sanitation, like after COVID, even now people will sanitize their hands 20 times in a day when they don't need to. That's going to create a very unusual micro burden, microflora burden on your skin and your body. And remember that those are chemicals that leave residues, which are eventually going to go into your gut. And that's where this whole theory of dysbiosis comes up from. So dysbiosis then leads to the tilt from the Th1 to Th2 and the imbalance. And as a result of that, with all this, the genetics, the epigenetics, the environment, the maternal microbiome, the mode of delivery. So there have been studies which have shown that if you're born through a vaginal delivery versus a cesarean section, the degree of microbial load that you're exposed to during a natural birth canal delivery is much higher, and that seeds the baby's mouth and gut, and that seeding has a huge impact on the baby's immune development. And interestingly, if we take that a step further, the importance of breastfeeding comes in, because breast milk contains some very interesting oligosaccharides which are critical for the healthy microbiome to develop in a baby. And so the minimum requirement, as you all may have heard, is at least 4 months of breastfeeding, ideally 6 months. Gladly, in India, we've had tradition where it goes on for longer than that. Unfortunately, it is waning away in many parts where you may know in your practices, but it is something that's very, very helpful. So with this, I'll shift a little bit and I'll talk about atopic dermatitis, which is a chronic relapsing inflammatory skin condition, affects about 10% of kids in India. Eventually, they outgrow it, adults 1 to 3%. And when you look at atopic dermatitis etiopathogenesis, you will see that there's skin barrier dysfunction. This can be genetic, inherited, it can be de novo. So you have something called filaggrin defects, you have something called FLV defects. There are many other things that are there. Combine that with the epigenome, the interactions between the environment and the child. You take the genetic variability, you take the microbial dysbiosis, you take the immune dysregulation, and potentially the hormonal exposures also as the child grows, and especially in females, we see that. And through that, you can then develop a chronic disease like atopic dermatitis. So again, a multifactorial issue. And what classic example of atopic dermatitis starts off as a Th2 disease and then becomes a Th1 disease. And this is a classic example of the chronicity of this disease. This is a very busy slide. I'm not going to go through every detail on it, but here actually it has been shown how right from the sensitization to the allergy and the manifestation of the allergy and the different symptoms that you would see in allergic rhinitis, whether it's the rhinorrhea, the sneezing, the itching, the congestion, the pressure, the tissue edema, the nasal blockage, and many other symptoms, how each of these occurs in the primary reaction and the secondary reaction, and over time the primary and secondary reaction merge, and then it becomes an issue that you are now dealing with a problem that is chronic and persistent. And there are clearly, when we go through the allergic rhinitis module, I will give you a lot more data on this, especially how the drugs work, what immunotherapy does, etc., etc. That's not a talk for today. Today, it's more about understanding how this disease develops, how this disease initiates. And again, I have seen kids 6 months, 7 months with severe dust mite allergy and starting to have rhinitis by the time they were 6, 7, 8, 9 months old. I would not see this in India when I was doing my MBBS at St. GS Medical College, KM Hospital. I don't remember seeing on the pediatric wards kids with allergic rhinitis at that age. In fact, when I think of the wheezers on our ward, there would probably be 2 nebulizers that I would see max in the middle of winter. Okay, I'm not joking. And today, if I go with my friends and do some rounds or some teaching, more than half the ward is on nebulizations at the certain times of the year. So clearly, the disease pathology, the disease progression, the disease incidence, prevalence, everything has changed. And unfortunately, we are to blame for it. When I say we, I mean collectively everyone, okay? Because we are not being aware about why this is happening, and we are consciously not doing anything about it on a personal level and then on a more generic level. And I'll explain that to you in a little bit. It may sound a little drastic, but the way I look at life and the way I look at immunology and allergy, it's a very classic example of where a disease was very rare or infrequent in the past. I won't say very rare, infrequent in the past. It has become extremely common now, extremely common. Asthma pathogenesis, almost the similar pathway, again, acute and chronic phase. You look at all the different triggers, you see a long list of respiratory allergens, infections, pollution, drugs, cold air, exercise. You can see that there are non-allergic triggers in this, and even an allergic asthmatic has many non-allergic triggers. And this is where that entire thing about allergen specific and allergen non-specific responses of the immune system becomes very important when you're trying to manage a chronic allergic disease. I'm not going to get into this because this is really going to get covered in the later asthma module that we will have. Because we now have all the phenotypes and endotypes of asthma. Asthma is not one disease, it's 16 different diseases for me. And in that, there are many possible permutation combinations of what that person came from, when they started, what happened, what symptoms, what tests, what results on their reports, what their exhaled nitric oxide is. And from that, we realized that the diseases have many different presentations, and some of them are non-allergic. They are neutrophilic or inflammatory in other mechanisms other than allergies, or eosinophilic and non-eosinophilic, possigranular, neutrophilic. There are many, many different subtypes. So it gets more and more complicated. I mentioned this a little bit earlier, the atopic march, where you start off with potentially atopic dermatitis, potentially food allergy, and then convert into starting having wheezing and asthma and eventually allergic rhinitis. And as you can see, by the time as the kid is about 5 years old, they've gone through this entire spectrum, or a series of kids, not just one child. Because not everyone goes through the march exactly that way. Someone skips the march. I know people who start 3 steps of the march together. Okay. By age 1, they have eczema also, they have food allergy also, and they have wheezing also. Okay. They never followed the march. They decided ek saath sab karenge, wholesale mein. Okay. So while we call it the march, it is not necessarily a march. But we do see the march where the eczema goes into remission and then the allergic rhinitis comes up or the asthma comes up. But it's interesting to see that as one organ system matures, for example, the skin and its barrier, another organ system becomes susceptible. But the pathology underlying both, which is the atopy, the predisposition to become allergic, is still the same. Okay, that has not gone anywhere. So what we're going to say in the next probably 20-25 minutes is the complex interplay between the inner and outer environment in allergy. So right from, as I mentioned, the microflora inside you to the epigenetics and your exposures and modifications to the environment and drugs, and then all the genetic factors that go into it that ultimately lead to an allergic disease. This is a little Q&A from the questions we commonly get in our clinics. Okay, is allergy genetic? The answer is yes and no. Why did I say yes and no? Because you would say it is genetic. Well, I will present data that you'll see that it is not genetic the way you think genetic means, got from mother, father, grandfather, grandmother, not like that. You have de novo mutations. Okay, so there you can't call it that it's inherited genetic. It's a new genetic mutation. Now their kids are going to have it later on, but they didn't get it from any genetic risk. Is it fatal? Yes, it can take lives. Food allergies, insect sting allergies, drug allergies. Drug allergies contribute to very, very high numbers of reactions in hospitals. When you take all the iatrogenic incidents that occur in our hospitals, a big portion of them, some people say 20-25% of them are drug related, okay? And it's some immune mechanism by which it has caused a reaction, if not a biochemical reaction of some other kind. Is allergy contagious? No. I get very, very educated people asking me this question, okay? Certainly the infections that allergic people catch is transmissible to others in the family because they catch it more easily. But allergy itself is not contagious. Is it curable? Yes, you can do immunotherapy. It's sometimes very much curable, very much amenable to very excellent treatment. Does it occur at any point in your life? The youngest patient, as I said, was a few days old. And the oldest patient I've seen was 96 years old who had a new onset allergy. Okay. So it does not spare anyone. Anyone. That's the answer. I used to be taught that after age 60, you go through immune senescence. So you don't develop too many allergies. And I can't tell you how many 60, 70, 80-year-olds I'm seeing with allergies in my practice every day who are having new onset issues. Not always the classic allergies we see in kids and teenagers and young adults, but they are allergic for all the right reasons, if you were to evaluate. Can it occur anytime? Yes. Can it get better on its own? Yes, that's what you call going into remission. It happens. As I said, atopic dermatitis or food allergy is a classic example. We'll go through in the food allergy module, in the atopic dermatitis module, but very classic examples and very good examples. And there are features that you can know who's going to go into remission and who's not, and who's going to go down the atopic march and who's not. So stay tuned. If you'll keep meeting me once a month, we'll go through all these things if you're really interested in this stuff. And can allergy make you feel sick? Of course it can. Can it change over time? Yes. Can the target organ change? We already spoke about this. It can change very, very quickly sometimes. So this was a very interesting study, part of the multi-center study done in Germany, where they took kids who were having asthma, diagnosed asthma, well diagnosed. There's no error in the diagnosis, okay? And they tried to figure out what was the family history of these kids. And remember that when you talk about child with asthma, there's a 85 to 90% chance that the child is allergic. Okay. In adults, we say 50 to 60%. Pediatrics, it's 85 to 90%. If you have a diagnosis of asthma and you've not done an allergy skin test for that child, then you're really missing something. Okay. So when they did the study, very interestingly, 56% of the kids with asthma did not have parents with any kind of atopy or atopic disease right from birth till the point that they were being evaluated. Okay, that's why I said allergies are not always genetic. They are de novo mutations or changes. There are over 50 genes that have been associated with allergy so far, probably more than 100, but 50 that have been very rigorously studied. And one atopic parent in 38% and two atopic parents in only 6%. And I actually see this in my Indian data because I take very careful family histories, my assistant first and then me. And it's not always that we get children or teenagers or young adults who have any history of allergy in their family. And that's why I'm saying that India as a country is really moving very rapidly to becoming allergy capital of the world in the next 2 decades or so. So if you all have a deep interest in this field, you all are in business. I don't want to be in that business. I'm not saying that way, but it's only going to increase. You will see why in the next few slides. The majority of affected children will not be identified at birth by family history. No family member, risk is 5 to 15%, one sibling 25 to 35, one parent 20 to 40, both parents 40 to 70, both parents with the same symptoms 50 to 80. So pretty convincing data that you're dealing with a genetic issue if you have parents with it. Interplay of infections. A virus can be associated with the onset of allergy also. It can be associated with the exacerbation of allergy also. Same with a bacteria. Okay. And same with the fungi. Now, I'm not going to go into this data because in each organ system, this is going to vary, and we'll discuss this in the future modules. And it all begins in the womb. This is where my passion and interest lies. Because if you really have to do preventive care for allergy, you have to begin with the woman in her pregnancy and preferably even before she gets pregnant. Okay, that's how early you have to start. And you'll see why. So this is one example where I've given the correlation of maternal stress with wheezing in the first year of life. So maternal stress causes HPA axis dysregulation. This dysregulation affects the baby's HPA axis also, causes the autonomic nervous system of the baby to get affected. The epigenetic changes that occur due to this HP axis dysregulation leads to oxidative stress. Remember when I told you everything in allergy is stress, a big part of that stress is oxidative stress, what you would call as reactive oxygen species, okay? That oxidative stress leads to skewed immune development. So where it should go from Th2 to Th1, it stays Th2 even after birth. And then that leads to allergic disease in the offspring. And also structural developmental changes occur in the airways, the immune system, the gut, which then affect the development of disease. And in this very interesting study, where mothers were studied for their perceived stress levels and also for depression and followed postnatally. Kids were followed at age 3, age 10. Increased wheezing illnesses seen in the first 3 years of life, and moderate wheeze with low atopy respiratory phenotype. So these were not very allergic kids, but they were still having asthma. So these would be that 15% of kids who have non-atopic or low atopy asthma that was seen, indicating that the changes that have to happen, you can call it the hardwiring of the immune system, of the respiratory system, of the hormonal system, begins very early in life, even before the baby is born. So maternal exposure to both indoor and outdoor pollutants, there are very good research papers and stuff that are there on this. Cigarette smoke from the mother, even the soaps, detergent, microplastics, increased antibiotic use in the mother. I would even add here the use of NSAIDs by the mother during pregnancy, okay? All have been associated with increased risk of having dysfunction. And as you can see, if it's a skin epithelial dysfunction, there are then after the baby's birth, outdoor indoor pollutants, smoke, bacteria like Staph aureus, food allergens, vitamin D deficiency. Vitamin D should also be there on the mother's side because there is data on that also, some mixed data. Microbial diversity, genetic influences like gene mutations, and then in the airway epithelium, gut epithelium, leading to food allergies. There are multiple such exposures that lead to problems. Now, how does this really work? So, any kind of stress, now remember, I'm making a big statement here. For most of us, when we hear stress, we are thinking mental stress. Mental stress is not the only form of stress. There is physical stress, not sleeping properly, not eating properly, working too hard, working too long. Okay. And then there is chemical stress, eating the wrong foods, living the wrong lifestyle, having the wrong habits, having the wrong addictions. Okay. Chemical stressors. Then there is mental, psychological, emotional stressors. And then beyond that comes something called etheric stressors. And beyond that comes spiritual stressors. We'll talk about that some other day. I'll mention it though in later part of my presentation. But that stress combined with any major life event or some incidents or something so for example, I see so many young girls who are pregnant and they are still working full time, sometimes into the 8th, 9th month of pregnancy, high pressure, high work, a lot of travel, a lot of eating out. And I'm just thinking, to myself, if they ask me the question, I'll guide them. If they don't, I'm just thinking, well, what are you doing to yourself? Forget what you're doing to yourself. What are you doing to your baby? Okay. That's not how you're supposed to live if you're pregnant. Now, some people will be unhappy when I say that, but if you want your offspring, your child, your progeny, your future to be healthy, you will have to start thinking this way. And I don't know how else to do it because I have looked at these things very closely in the 34 years that I have spent in the field of medicine now since I entered MBBS, to understand that these little changes that start very early in life. And I'll give you a classic example. Everyone here knows about the Mahabharata. Everyone here knows that Abhimanyu learned how to bathe the Chakravyuh while his mother was listening to Krishna, and then she fell asleep and he didn't know how to get out. Okay, mind programming begins in pregnancy. So everything that the mother is seeing on the screen, now the baby is recording, and then people ask me, डॉक्टर ये 9 महीने के बच्चे को मेरे से अच्छा फोन चलाने को आता है, अरे माँ ने पूरे प्रेगनेंसी में ट्रेनिंग किया है उसका, वो बच्चा अंदर सब रजिस्टर कर रहा था, अभी उसको कुछ ट्रेनिंग की जरूरत नहीं है बाहर आके, आप लोगों को महाभारत एक स्टोरी लगेगा, मैं उससे बहुत कुछ सीखता हूँ और मैं एनकरेज करूंगा आप लोगों को ऐसी तरीके सोचने के लिए, एंड मैं आगे बातें भी करूंगा ऐसे तरीके के. But realize that everything that the mother does, the baby is registering whether you like it or not. So if the mother experiences stress, the baby experiences stress. If the baby experiences stress, the baby now picks up imbalances somewhere or the other in the hormonal, immune, structural system of their body. And then you're wondering, how is this child at such a young age having these problems that we have never seen before? Okay, or which we did not have any time in our family. And to me, it's not a rocket science. Okay, and as doctors, I will speak to you all a little later about some other aspect of the way I look at this. But in this process, the perceived stress moves the mother from a Th1 to a Th2 pathology, and the Th2 pathology in that baby's body now manifests as an allergic disease. My love for ancient India, I cannot live without mentioning this. We were so amazing. Our Rishi Munis thousands of years ago designed a process called Garbh Sanskar, okay? Educating the fetus in the womb. I still consider it as the most smart preventive pathology system that you can ever have in the life of any living human being for that matter. Imagine making the mother feel loved, cared for, well fed, protected, safe, and encouraged. Can you imagine the kind of baby that mother would have? And this is all that the different sanskars in Garbh Sanskar used to do to a girl's body and mind. And while we have followed some of it through our traditions, our incidence of allergies have been low. And now that we've gone into nuclear families and we consider all this to be voodoo science, and we no longer look at it or even spend time on it because it does take time, we are now dealing with all kinds of non-communicable diseases rising in our lifestyle and body. The start is here, okay? Whether you like it or not. From the womb, I'll move now to pollution, and I'll talk about outdoor pollution and indoor pollution. The bottom line is any type of pollution. You know what they are. I don't need to teach you. I will discuss it in my allergic rhinitis and asthma modules also. But this leads to, again, oxidative stress. The oxidative stress leads to inflammation. The inflammation leads to allergy, asthma, whatever you want after that, okay? So the bottom line is there is a very clear delineation, and there are tons of study now correlating pollution with allergies. A very interesting study was done where they took diesel exhaust particles, which, by the way, are very irritant, and we have tons of it in Mumbai. In monsoon, when it rains, our pollution levels are great. We are at 50, 60 AQI. But all other times of the year, we are 100, 120, 150 AQI. Okay. So we are not safe anymore with all the sea breeze, land breeze that used to protect us till a few years ago. Now, when you take diesel exhaust particle and you take ragweed pollen and present that to the immune system together, you get 40 times the IgE production than you would if you gave only ragweed alone to that person. So many of my patients say, sir, US जाते हैं, ऑस्ट्रेलिया जाते हैं, हमको एलर्जी नहीं होती, हम सब दवाई बंद कर देते हैं. मैं बोलता हूँ बिल्कुल होएगा, वहाँ पोल्यूशन नहीं है, राइट? ऑल्सो तुमको स्ट्रेस बहुत कम है वहां पे, तुम एंजॉय कर रहे हो, पार्टी कर रहे हो, घूम रहे हो, खा रहे हो, तो ऑब्वियसली सारे सिस्टम्स तुम्हारे अच्छे चलेंगे. यहाँ आओगे वापस, स्ट्रेस, पोल्यूशन, एवरीथिंग, एंड द प्रॉब्लम्स विल कम बैक. But there's very interesting data on all of this that is there. Pollen become more allergenic when these trees grow in an urban environment. They also, the pollen volume increases drastically. Okay. Indoor air pollution, there's immense data now to show that biomass fuel, even from early age, can affect lung growth, lung development, and eventually to asthma and even COPD. So all the non-smokers COPD that we are seeing today is largely related to indoor air pollution. And in India, we have very high levels of exposure. I'm not going to go into too much detail. I had mentioned obesity there. Now, obesity, as you know, is an inflammatory condition by itself. And obesity, when combined with all the other inflammatory features that are there around us, can really lead. So this is a classic example of where obesity increases the susceptibility of the lungs to air pollution effects. This is one double hit that I'm talking about. There are many such double hits. Obesity with wrong diet, wrong lifestyle, wrong this, wrong that. The inflammation just skyrockets. And it's interestingly that Hippocrates, who, by the way, was very much influenced by Indian philosophy also in 400 BC. He's considered to be the non-crowned father of modern medicine, right? Hippocrates. We all take his oath when we do our MBBS. So he said that let food be thy medicine. Now, if you tell this to your patient today, वो हंसेगा तुम्हारे ऊपर, बोलता है क्या डॉक्टर खाने पीने पे दवाई बोलो क्या लेना है. Introduced the idea of the potential impact on food on health, and Charaka Samhita 1000 years before that, 1400 years before that, in 1000 BC, had already said and given detailed outline of how food as energy and food as influence on role and health and disease is very much there in our systems. And what have we done? We are following an exclusively westernized medical science. I have nothing against westernized medical science. I practice it every day, living in and out. But I believe that we need to look at our past also. And there are lots of things that I'll talk about in my future presentations in the other modules regarding that, about food, diet, all those things. Systemic and airway effects of dietary patterns. As you can see, a Western diet, which is, by the way, also called a SAD diet, a standard American diet. Nice acronym, na? SAD. It actually makes you sad. It makes you depressed. It makes you anxious. It makes you worried. So it gives you a lot of neurological issues and psychological issues. But the effect it has on the gut bacteria and then on the metabolites that the gut bacteria produce then determines the development of inflammation in that organ system, as I told you, whichever is the weakest link in that person, and they manifest disease. Whereas when you have fruits, vegetables, more healthy, natural, original foods, the bacteria are of a different kind, your microbiome changes, the type of short chain fatty acids that the bacteria produce changes, and then the inflammation changes, the diseases change. So these are all very relevant and important to us even today. And as you can see on the right side of the screen, there's more neutrophils, more cytokines, more inflammation, and the person is having a nice juicy burger right there. Okay, from there we move on to all the other factors that we are exposed to, right? From the pesticides, the herbicides, the phytochemicals, the food colorings, the food preservatives, the E412, E7112, E this, E that, which none of us ever care to look up. What is that E thing that has been approved? There are about 1,900 of them, and they are there in our foods, okay? Then our personal care products. It is estimate, and we do this because we do contact dermatitis. That's part of what I do. In contact dermatitis, it's estimated that a human being, from the time they wake up in the morning and they brush their teeth, कभी toothpaste के अंदर देखना कितने chemicals है, okay? वहां से के लिए रात तक, मतलब दिन में साबुन लगाया, शैम्पू लगाया, बॉडी पे क्रीम लगाया, मेकअप लगाया, ये लगाया, अगर लेडी है, जेंट है तो स्प्रे मारा, परफ्यूम मारा, डिओ लगाया, ओके, फिर खाना खाया, फिर बाहर का खाना खाया, घर का खाना खाया, बाहर का पानी पिया, घर का जूस पिया. 150 chemicals go into your body every single day, which nobody knows what it does to your immune system or your gut or your body. 150 chemicals. Average human being. If you're a heavy cosmetic user, then it may even go up to 250. Or a heavy outside food eater, I don't know what will happen, okay? But the bottom line is that unless we wake up to these things and we incorporate a healthier diet and lifestyle, I'm going to be doing more and more of these programs. Okay. And I think each of us has to wake up. Then you add the medical, the pharmaceutical, the drugs, the devices, the waste, the products, the clothing, the furniture. I get so many patients, when they wear clothes and come to the clinic and I have to give them an injection in their upper gluteal area. When I clean their skin, what I'm getting off the skin is the color of their pants or their trousers or their lehengas. Okay. You think that the clothes में जो coloring है वो benign है, नहीं, वो चमड़ी में जाते चमड़ी के अंदर भी जा सकता है. So it is so prevalent what we are exposed to today that unless we really wake up and know what we are doing with our bodies, we are going to be left with more and more new manifestations of new diseases that we are going to be struggling and fighting with. Plastics का मैं बात नहीं करूंगा. Everyone has heard of it. Early life factors, you all have heard this. With this metabolic programming, the immune programming first and then the metabolic programming, not just allergy, but all non-communicable diseases are increasing, okay? What I'm doing as an immunologist, as I said, my field goes into multiple branches. When I did my final boards In America, there were questions from neurology, there were questions from rheumatology, there were questions from you name a branch and a field, we had questions from it on our boards because the immune system is everywhere. It has been shown that now one of the final features in a heart attack, when a person gets a heart attack, is an immune mechanism with mast cell degranulation and clotting occurring related to that. So there is no field in which immunology doesn't go, and hence this topic that I'm covering is focused on allergy but applies to all areas. Very interesting study, 1 minute on this, but when we are stressed, we also make all the wrong food choices. Okay. And this is a very important thing because stressed emotional eaters ate more sweet, high fat foods and more energy dense meals than unstressed and non emotional eaters. Okay. We all call this stress eating, right? And imagine how many of our children, teenagers, adults, and we ourselves are doing that on a daily basis. It is unbelievable the way in which we are not assessing the importance of stress. There's also very interesting data in the rural urban migration. And even I would say India to US, UK, Australia migration that I see in children whose parents bring them back, their allergic diseases and severity of allergic disease becomes much higher when they go there. In the farming environment, through the endotoxin, through the bacteria, the microbes, does a lot of immune training that is invaluable for the immune system to become non-allergic. And even in India, the allergy rates in really rural areas is much lower than it is in urban or semi-urban areas. I'll again go into this in more detail during the asthma part. From air pollution, now I'm going to go to mind pollution. I call that stress. Okay. You may not agree with that, but for me, taking stress means mind pollution. And you can see all the reasons why it happens. I'm not going to go through all of that. And interestingly, many, many hundreds of years ago, this is the statement from King Solomon, who said that a merry heart doeth well like a medicine, but a broken spirit drieth the bones. Now, he didn't know about bone marrow, and that's where all our immune system is based. But the bottom line is a happy person stays healthy and heals faster, while a sad, depressed, unhappy, anxious person falls ill more often and takes longer to heal, and sometimes doesn't heal because their immune system is either dysregulated or weakened. So as I mentioned, Th2 promotion is done by the stress. Stress and allergic disease, the perceived stress leads to allergy flares. All of your patients must have told you one time or the other that under stress, their either itching increases in eczema or their rhinitis increases, or they get viral infections during exams or major board presentations in office, or when they're having stress with their spouse or whatever else. School exams and antigen challenges have revealed that you're in a more hyper-reactive state when you're under stress. And then parental stress as a wheezing indicator and also as atopic indicator in the first 2 years of life is very well determined. So this is my area of passion. I say no meditation, no life, and no meditation, no life. If you all are interested in this, I am working on a program where I'm going to invite just doctors, because I believe that if a doctor gets healthy, then thousands of his patients and families will also have a better life. So if you are interested in stuff like this, speak to me after it. I already conduct programs in general people. They happen every month. We have sessions over a weekend. But I truly believe that we need to give time for ourselves, because we give time for the whole world, okay? For our family, for our patients, but we never give time for ourselves. And it's very critical that we do that, because if you are under high stress versus you are under low stress, you can imagine how much better you would perform both for yourself, your family, and then for society. These are some of the seminars we do. We start very young. We have seminars with kids. I conduct adult seminars. I even go to the US and conduct them. It's my passion and love. I've been doing this for many, many years. And there are many, many different types of techniques and stuff we do. This is our basic program. And I always end with this statement for doctors that physician, heal thyself. Heal thyself means physician, healthy self. Okay. I think that it is so important that we take care of ourselves. पेशेंट्स कभी खत्म नहीं होंगे, आप और मैं खत्म होके धूल बन जाएंगे. पेशेंट्स कभी खत्म नहीं होने वाले हैं. अगर आपने आज या कल टाइम नहीं निकाला तो जिंदगी खत्म हो जाएगी, बट काम खत्म नहीं होगा. So with that statement, I'm going to initiate, because Compass is a journey. Compass is not one program. Okay, if you're thinking this was a nice program but इसके अंदर डॉक्टरों ने कुछ भी डायग्नोसिस और मैनेजमेंट का बात नहीं किया, कोई दवाई का बात नहीं किया, पर्पस ही नहीं है उसका। आज पर्पस है आप लोगों को जगाने का कि बाबा एलर्जी बहुत बड़ा प्रॉब्लम है, आपके 50-60 पेशेंट्स को ये है, कम से कम 30-40% पेशेंट्स। आगे आओ आपके इंडिविजुअल फील्ड्स के हिसाब से एंड इवन इन जनरल grow, evolve. Allergies are rising in all age groups. Allergies are truly multifactorial. They have to be approached with an open mind, high index of intuition and suspicion. They are life altering and definitely life threatening at times. And with the right understanding and knowledge, we can both prevent and treat allergies much better, sometimes beginning very early in life. So, with that, thank you very much. We have about 20 minutes for questions. Again, thanks to Hetero Healthcare for really coming up with this idea and approaching me. They've been after me for almost 2 years. I wasn't being able to make the time for this thing. But now I've taken it up as a commitment that I will do this. Every month we will have programs, different modules. There are 12 modules, 2 we've covered today. There'll be more coming up, and I look forward to seeing you all again and again, hopefully in the near future. So yesterday I was clever, so I wanted to change the world. Today I'm wise, so I'm trying to change myself. And I think that is my final parting advice to each one of you, that as much as we gain information, it will never end. But when we work on transformation, when I say transformation, it is within ourselves, it really makes a big difference. Then not just to us, to everyone else also. I am on Instagram, I am on YouTube, I am on LinkedIn, I have my website, I do a lot of work on social media. I don't do a song and dance and then talk about allergy. It's very pure, hardcore allergy immunology topics that I give to my patients. I give to friends, family, relatives who are interested. I did over 150 videos during COVID, which were hugely received by people, talking on the most hard-hitting points of COVID, right from the drugs to the vaccinations. And it's just my passion and love that I feel as an immunologist, I'm in a unique position, and I like to share that with all of you all. So thank you very much for your attention, and thanks again to Hetero Healthcare. I'm happy to take any questions you may have. In or outside this topic, doesn't matter to me. Thank you. So I won't say that necessarily pollen is more in the urban area. Okay, we are cutting down trees so left, right, and center. We can't be having more pollen than there are if you go to Karjat or Kasara or one of those places. We are not having more pollen. But because of the combination of pollen with all the air pollutants that we have, the impact of the pollen is going much worse. Its chance of inducing allergy is much worse. So if you have a Congress grass, which is Parthenium, it's a very potent pollen producer in Mumbai, and someone exposed to that, and you have Parthenium in a rural area and someone exposed to that, the chance of the person who is exposed to Parthenium in Mumbai becoming allergic to that Parthenium pollen is going to be much higher. Also, with the high heat indices, the pollen production goes on for longer. Now we are having rain in a very unseasonal time. You know, the way I remember growing up in Mumbai, then I went off to US for 14 years, came back, we would never have so much rain post Ganpati. Between Ganpati and Navratri would be a relatively very low rain period, and then around Navratri again some rain, and then no rain after that. And the kind of rain we are having, that clearly our climate is changing. Global warming is huge. And when you have such long damp periods and then dry periods, you're going to induce mold, you're going to induce pollen. We'll talk about this in our later modules. But what I spoke about is that yes, the trees are producing more pollen for longer, and the pollen combined with the outdoor and indoor air pollutants becomes more highly allergenic in its nature.
So do you
What
think
are
the
the-
balcony plants which we have, it's a bad idea in an
No.
urban area?
Balcony plants don't usually produce pollen.
What if they are floral plants?
Even if they're floral, remember, if you would never keep those tiny little white or pink, you would keep nice floral plants, right? Those nice floral plants are never wind pollinated. They are all insect pollinated at best, and those insects are not going to come to your house. So the pollen comes from those trees and weeds and grasses which have tiny, tiny flowers which you really can't see, and the wind has to pollinate them. So that's where you call them the anemophilous pollen. Okay. versus the zoophily and the other ways of pollinating them. So the household plants are an issue when you overwater them, when you get mold in your plant pots, and you increase the dampness in your rooms and houses if you keep them inside. The real pollen with plants is there. Real problem with plants is there, not with their pollen production at all.
So why would overwatering cause that?
Because then you're asking for more mold, no? If you put a plant which has you water once in 2 or 3 days, you'll never see like a white fungus growing on it. You water it every day and keep it really damp, you'll start seeing white fungus all around, green fungus, gray fungus, all kinds of stuff will come. Now, those are going to sporulate and release stuff in your house. Also, if you have retainers next to it, you're going to ask for mosquitoes. Mosquitoes are bad allergens in India. They are not just biting us, but and obviously they are the top killers around the world for the diseases they carry, but they also die around us, become ultramicroscopic dust, which becomes an inhaled allergen. So there are many ways in which plants are bad if you don't take care of them. But plants don't produce pollen that make you sick in the house or in your balcony. You just can't.
Also,
What are
you
the most
mentioned
common causes of allergens below 6 years you feel here in Mumbai? Below 6 years?
Are you
common.
talking of environmental like inhalant allergens, or are you talking about food allergens and all included?
Yeah, just enumerate what they are.
Okay. So this topic actually gets covered in the later modules, but I'll give you an idea. So for example, the commonest allergen that we see in children, teenagers, and adults in India is house dust mite. Okay, house dust mite allergy is the commonest allergy by far. So if you take 100 allergic people, around 60 or 70 of them will have a dust mite allergy. Following that very closely are things like cockroach, mosquito, some of the indoor insects which are very prevalent. How relevant they are to the clinical symptoms is a different story. I'm talking sensitization right now. And then you have animal dander, which is not very high. You actually have a lot of mosquito and rat allergen sensitization that does occur. How relevant it is also not studied in India, and abroad it is. And then you go to the outdoor allergens. Indoor may also have molds. Molds are fairly common. And in the outdoor, you have several pollen, like you have something called Dhurva grass, which is called Cynodon dactylon. You have something called Prosopis juliflora. It's a flowering tree, big one, grows all over Mumbai. It's been planted in many areas because it gets nice flowering during certain seasons. Similarly, there's something called Ricinus, which is the castor plant. There are several such indoor and outdoor allergens. And then in foods, you have the typical ones, but abroad, and this will be part of other presentations in the food allergy module, but milk, egg, wheat, soy, peanut, tree nut, seafood, and shellfish, and now sesame are the top 9 allergens around the world. But in India, we have a different top one, in my opinion, along with these 9, and that is all the legumes, the dals, which people don't look for always or test or evaluate. And they are huge. Means I have seriously anaphylactic kids, teenagers, and adults who have like serious besan allergy, chana dal allergy, tur dal allergy, all of these allergies.
Which dal is more common allergy?
Chickpea, chana dal, besan. It's partly because it's also, I believe, to some extent GMO, genetically modified now. Was that? Yes, please. I'll be more than happy to take them.
Yeah, this is Dr. Kamlesh Haria from Prabhadev area. So
Yes.
I wanted to know about your the de-stress sessions which you have. So when do you plan it? Is it a weekend or then where is the venue generally like?
Okay. Thank you for that question. So it is on weekends. It's usually a Saturday and Sunday program. The program that I am eventually designing focused just for doctors called Healthy Living will be just a weekend, a Sunday program. It will be probably 4 or 5 hours on a Sunday. We are still working on the program, and I'm working with the hetero team also. If they find it feasible, if not in other ways, we will do it. But the Happy Living program that I had presented is a 2-day program, entire Saturday, entire Sunday. And we hold it generally in the Goregaon Malad area only, because that is where most of my team is based. I have a team of about 12 to 15 individuals, and we all come together and do these programs. For anyone above the age of 15, they are able to attend those sessions if they would like to. There are advanced programs beyond that if someone is interested. So those happen once in a couple of months. It's purely for the person's interest, and I never recommend it for diseases or health. I recommend it for a good, happy, balanced living, that I encourage people to do it. And there are many, many, many benefits out of it that people have gotten over the years. We've been doing these seminars for over 25 years now.
Yeah, great. One more thing is many of these food packets labels have some coding, like we are not able to decipher it. So how should we be able to do it? Probably.
Unfortunately, the way the system is designed, there is no way to know what it is unless you go to Google. If in Google you go and you type in just those letters, now it will immediately tell you everything you want to know about it. So if it says E125, it will tell you which category of food product it belongs to, or coloring it belongs to, or preservative it belongs to. It will tell you what its chemical composition is. It's a very effort intensive process if you want to get into that. So many a times when parents ask me now that, Dr. Roy, what are the things we can do to reduce your child from going into the hospital so often, or getting sick so often, or what an adult tells me, what can I do to reduce my risk of exacerbations and problems, I will often tell them that avoid packeted foods if you can. Okay, because how much are you going to read? Now if there are certain things that you eat very frequently, you can certainly take the time and the effort to read up, because if you call the company and try to ask them about it, it's going to be months and years. Phone pe phone, you'll be on waiting forever in most cases. So when I have to evaluate, or I'm evaluating a child or an adult for a food reaction or something, I actually have to myself or have one of my staff members or assistants look at what of those E's are, find out what the active ingredient is, and then look at possibly testing that adult or child in whatever format, whether it's a skin test or a patch test or a food challenge if we have to do it, because many of these substances will not appear on any blood test or skin test allergen panel that you have. So it is a effort intensive process. That's why I mentioned, there are over, I think in India there are 1,200, worldwide there are even more of these whatever numbers, and we really have to take the effort to study what they are. Some come very commonly in foods like in breads, biscuits, and you can look them up. The ones that are more esoteric and more less commonly used products, you have to gradually then get a comfort level with knowing what they are.
Thanks.
Welcome.
So we have one more question.
Hello, Dr. Roy. I am Rajesh Ledkar from Mumbai, Leelavati Hospital. I enjoyed your talk thoroughly. What do you think, and what are your thoughts of maternal anxiety in relation to allergic manifestations in children, in their children? Because you talked of antenatal, factors, but do you think that an anxious mother has some kind of contributory role in the hyper manifestation of the immune system of the child in allergies? And do you think some amount of the treatment to allergies should be targeted at such anxious mothers? Thank you.
Very good question, Dr. Kedkar. I would say 200%. It contributes, not 100%, 200%, maybe even 500%, to just emphasize my point. So when I spoke about maternal stress and prenatal maternal stress or depression or anxiety, all of those are clumped together in those studies actually. They also looked at what happens after the child is born. And if the mother were to develop such symptoms later, what would happen? And as you can expect, an anxious or a worried mother is going to have a certain impact on that child's care, whether it is rushing to the doctor more often, asking for antibiotics for the slightest cold or fever, Remember, if you have too many antibiotics, you now damage the gut microbiome in a big way. So, right from the things that the mother may do in the interest of the child, but because of her anxiety, not directed in the best interest of the child, to what I personally am saying, this is not based on research, energy wise, the mother's energy of being anxious, hyper, worried, tense, all that rubs off on the kids. We know kids are like, I say this, I was also once, kids are like monkeys. They mimic what the parents do. They learn from their parents, right? They're the first teachers, gurus, masters. So if the mother is always hyper anxious, worried, the child is also going to gain some of those traits over time. And that is going to translate into more clinical manifestations of whatever it is that the child is going to manifest. Now, that may be an early hypertension or a early skin disease or a early allergic manifestation. I don't know, but I do believe that, see, in the ideal world, and I actually do this with my patients because I have these programs where we offer them a chance to come and do what we call, you know, stress relieving, stress unburdening therapies and treatments and meditations. I do offer some of my mothers who are that way to come to those programs. The funny part is that in today's day and age, people are so busy that they don't have time even to take out 2 days for themselves. And I'm saying this for everyone here, including myself at times, okay? So while I offer this to maybe 10 people, one person makes it to the program, which I'm okay with, because I'm not doing it because I want to prove something to anyone. I just have a blessing that I have in my life, which I want to share with people. If they get the value out of it, it's great. But the point is that yes, we need, and I think in every ailment and disease, we need more and more mental health care, core care, as I would say, looking at the mind part of the disease and not just the physical manifestations through drugs, inhalers, sprays, creams, and all the other things. If I know that even if the mother's diet were to change, her anxiety levels would come down. I'm that much of a believer in diet, lifestyle, and the impact it has on mental health. So some of these mothers, I even invite them to do diet counseling sessions with my team, and that has helped them immensely. They've come and thanked me later. Some of them, if all they understand is going to a psychologist for counseling, we have them do that. If someone only understands going to a psychiatrist and taking medicines for their anxiety and their stress management, then we do that. If they have a sleep problem, we work on that. So I believe that it's a huge part of what we need to be doing, but we don't always have the time or the resources to deal with it. But 100%, it's not just prenatal, it is postnatal, and it is whole life also. I would tell you that any one of us, if one of our relatives became unwell and we were having to go and take care of them, our perceived stress levels would skyrocket. And around that time, we may start manifesting headaches or body pain or back pain or whatever else you want. Means that's the beauty of mind body medicine. It is there at all age groups, not just in our children. Yes, we have a question from Thane. Please go ahead.
In fact, again, Dr. Kamlesh here. So very apt because today is a World Heart Day. So as doctors, I think so we think a lot about the patients and we give a lot of advice. But it is very apt that we also are into that fitness. We give time for ourselves. Maybe just 1 hour per day should be good enough. Yeah, thank you so much for all your advice inputs.
Sure, absolutely.
Hello, I'm Dr. Jiza Abbasi from KLS Memorial Hospital. I'm a consultant there. My question to you is regarding alkaline diets. We have got alkaline diets as a preventive measure for allergic diseases. Is it true? If there is it initiation of alkaline diets in a pregnant lady or in a young child can prevent allergic diseases? What is your role on that?
So, a very good question. Thank you for asking this. Let me break this down for you. So firstly, just alkaline diet, the way any one individual interprets varies from person to person, because on the name of alkaline diet, people have put all kinds of things out there. There are so many fad diets out there. When I think of an alkaline diet, I think of a diet that is an anti-inflammatory diet. Okay, I don't call it an alkaline diet. That's a false nomer in my opinion, because there are parts of your body that need to be acidic to function. If you don't keep them acidic, you're going to go into major issues, health issues. For example, people go crazy drinking 9.5 and 10.5 pH water. They end up with all kinds of weird gastrointestinal diseases and nutritive and metabolic diseases. So when I say alkaline diet, I don't actually like that word, to tell you the truth. I talk of more of a holistic diet, and a diet which involves less inflammation for the body, and 100% such diet. So they have actually looked at, I'll give you a classic example. They have looked at a Western diet, what is called the standard American diet or the SAD diet, as I mentioned, and something called the Mediterranean diet, which is supposed to be a more balanced with a lot more vegetables, fresh fruits, things like that. They have clearly found that the level of inflammation in the people who are following a Mediterranean diet is lower than what it would be in people who are following a standard American diet. Now, has this translated into prevention of allergies from a mother to a child? The answer is no. We have not been able to show that, because understand that a mother by herself is a very complex human being. She's not only food, right? She's emotions, energies, work, sleep, stress, so many other things. And yes, we do find that when they go on a diet that is more anti-inflammatory, their baby's chance of having allergic diseases in the first year or 2 or 3 of life is lower. But beyond that, that effect does not last, is what the studies are showing. So I think that there is a lot more that we have to learn, both about the mother and her physiology and her diet, and also about how the baby is eating, drinking, and being reared after the baby is born. So I think it's going to require what I call a continuum care. It can't be a care that you just say, okay, mummy ने अगर ये चीजें नहीं खाई तो बच्चे को ये नहीं होएगा. I wish it was that easy, but वैसा नहीं हो रहा है. They have tried vitamin D supplementation, they've tried omega-3 fatty acids, they've tried fish oil, they've tried all kinds of things which would be part of a more holistic, what would be called an alkaline diet. But really, the only thing that has been shown to make a difference is a lot of fresh fruits and vegetables, frankly. The only thing that I have found, because it also affects the mother's gut flora, right? So multiple ways in which it helps the immune system. But a very interesting question, and certainly something that we should all take with a pinch of salt, because again, I will go back to our roots. In ancient India, we had very good understanding of what an inflammatory diet is and what a non-inflammatory diet would look like. But we have completely lost and forgotten about it. And we follow only what we are taught from our textbooks and what is in our training, what we are reading on the internet or in social media or wherever else it is coming and it is teaching us. And so some of these diets are really not suited for our genes, unfortunately. Our genetics don't support them, and we are still doing it because there are solid media influencers who are saying that this is the next thing after the wheel being invented. I know it's a long-winded answer, but hopefully it gives you your answer. There is value to that diet, definitely during pregnancy, but done in the right way, not the way people are doing alkaline diets and alkaline water these days.
Why is the nuclear family shown as a contributing factor?
So this is an interesting thing. What happens is when you are in potentially a larger environment with more people around you, the belief is that your exposure to different microbes early in life is higher, and these microbes then have an immune modulatory effect on you. Problem is, in urban settings, this does not work because the microbes that we catch are usually influenza, RSV, rhinovirus, and all of these have been shown to worsen the risk of wheezing and asthma potentially in a child or an adult. So that is one theory that is prevalent out there, that when you are living in a larger family, more people, more interaction, more what is called a varied microbiome, because the diversity of the microbiome is more important than just the good bacteria. Okay, that's a very important thing. Now, the second thing that I believe is that I find, and I may be wrong in this, but just as an observation, and today's day and age is different than what I'm talking about from the past. But in joint families where you had support, you had help, you had ability to bank and fall back on someone, it was a more relaxed and calm and peaceful environment to grow up in. And so the stress levels used to be lower when there was shared responsibility. And when you're in a nuclear family and you're under a lot more stress, if you're also working, you have to take care of your family, you have to do many other things, there are a lot of responsibilities. And I believe that the stress levels, and there are some studies to show this also that have been done in Europe and other parts of the world, the stress levels in a nuclear family tend to be higher than when there is shared responsibility and there is more what would be called joint living or co-living, whatever you want to call it. So I think that it's more than just nuclear versus non-nuclear or joint. It has to do with diet, lifestyle, microbes, risk of infections, and stress levels all put together. I think we have one more question from Thane, I'm being told.
Yes.
Is that right? Please go ahead.
Nice. Very good afternoon, sir. I want to know the significance of high IgE levels, let's say more than 2000, if the patient is asymptomatic. Then do we need to, I want to know the significance. Do we need to dig more or what we can do?
Very good question. So I recently had a teenager about 16 years old who has an IgE level of 14,500, but has zero symptoms according to him. Okay. He has no nasal allergies, no ocular allergies, no skin allergies, no drug allergies, no food allergies, no asthma, no nothing. His pulmonary function test is rock solid normal. We did his allergy skin test. We did find a few sensitizations, I would call them. Now, interestingly, on a lot of further questioning, turns out that he does have some skin manifestations, which he has just learned to live with. Okay, he doesn't pay too much attention to it, but it would fall into the category of atopic dermatitis technically, but a very, very mild form. So your question would be, Dr. Roy, with a mild atopic dermatitis, how a 14,500 IgE, or in your case, let's say a 2000 IgE, I think the level of the IgE by itself does not mean anything to me as an allergist. Okay. If it is normal, I can still have an anaphylactic patient, and I have people whose IgE level is 35 and they will be in an ICU if they touch a peanut. Okay. Now, if this person only had an IgE, total IgE done as their screening, they would be, I'm sorry to say, but having serious problems in their health if they had not come to an allergist. So a normal IgE doesn't tell you much. Elevated IgE tells you that the person is at risk of allergies. Okay. Now that risk you have to then correlate with the person's clinical history. So this boy, at the first visit, though my assistant spent half an hour, I spent half an hour with him, nothing really came up on a very thorough exam, investigation, everything other than his skin test was positive to a few allergens. At the next visit, he came back and he said, Doctor, I thought about what you were asking me. And yes, this does happen to me once in a while. And it was an allergic manifestation. But again, the manifestation was nowhere close to a 14,500 IgE, which some people may classify as a hyper IgE syndrome. Okay. So the answer to your question is the high IgE should prompt you to look at every possible system in that child or adult as what could be an allergen. It can also prompt you to consider doing, potentially this being India and what the lifestyle of the child and the family is doing, deworming. I am not a very big fan of how much I see drugs like hetrazan being used left, right, and center when there's a high Ig and a slightly elevated eosinophil. I think we are really over treating a lot of people, but I'm not against it if the clinical scenario matches with what you are finding on the investigation. But generally, these kids who have, especially if it's a child we are talking about, right? In your case?
She is adult.
She's an adult. Okay.
60 plus.
So if you're talking of an adult, then like I said, there are, so a high IgE has at least 20 known causes. Okay. Other than allergy. Autoimmunity can give you a high IgE. Okay. Because the immune dysregulation affects both sides of the balance. There can be certain what I would call environmental exposures that can cause it, certain skin infections that can cause it. There are a lot of factors that can lead to a high IgE. In an adult, as I said, a very careful review of systems for all the possible allergic manifestations, followed by potentially allergy testing if it is appropriate and recommended and needed. And then after that, if you still find nothing and the person is asymptomatic, then I would say just follow them once in a while, because understand that allergies are a disease in evolution. Okay. Like I spoke about the girl in the beginning of my presentation who had urticaria and dermatographism 3-4 years ago, now has severe allergic rhinitis and asthma. We had no indication that she was going to have this later in life. She had an elevated IgE level, she had positive skin tests, but nothing that could explain the urticaria and dermatographism at that point. We treated her primarily for a non-allergic chronic urticaria and dermatographism. She got better with a lot of effort and diet changes and all. But now she has an allergic disease. Sometimes this 2000 IgE is a harbinger, a precursor to something that's going to happen in the future. You have to be aware of it.
Okay, sir. Thank you.
Welcome.
Thank you so much.
Yes, we have a question here. Just a second. We're waiting for the microphone.
Hello.
Yeah, hi.
Myself, Dr. Chetna Nagrale, sir. I'm a dermatologist practicing in Jogeshwari East. So my question is, what is the impact of puberty on a child with atopic dermatitis? Will the atopy improve with as the age advances, like after 16, 17, or will it be same?
Very good question. So, you know, when we look at a disease like, I'll give a parallel disease like allergic asthma. Okay. It said that around puberty and then around their pregnancy, a woman can either improve, stay the same, or get worse. I find that that tends to be what happens with other atopic diseases also. Okay. As they mature and get older and then start a family and things like that. What I will tell you is experience says that if someone has not outgrown their atopic dermatitis by the age of 5, 6, or 7, and they're still at puberty, still having atopic dermatitis, there's a high likelihood that they will continue to have problems in the future. Okay. Now, having said that, there have been some girls who have gone into remission. I find that happening more with boys, but can happen with girls also. It all depends. Like I said, you know, it is not as simple as just the hormonal changes in puberty. Is the girl obese or not obese? Is the girl eating a good diet, not eating a good diet? Is the girl sleeping well, not sleeping well? Is the girl having a lot of stress in her life, not having a lot of stress in her life? There are so many other factors that will determine if the ADERM will still be the same, go into remission, or get worse, that to give a single answer would be very difficult. Pattern says that if you have not outgrown it in the first 5, 6 years of life, you're probably going to have some form of it for a long time to come. It may be restricted to smaller areas, or it may convert into a hand foot dermatitis, but you're probably going to have some problem for a long period of time. But again, you know, it is never say never for me in the field of allergy or medicine in general. Everything that I've been taught or read in books is one day or the other proven wrong by some patient of mine. So what I will say is, you know, you counsel them about a healthy diet, lifestyle, exercise, right weight management, and sometimes the hormonal changes around puberty may actually put them in remission. At the same time, if they become obese, eat all ulta sida, you know, start having problems in their periods, can't tell, it may get worse.
Okay, sir. Thanks a lot.
Welcome. Did you have a question earlier, but we went somewhere else? I think right in the beginning, no? Okay. All right. Thank you very much. Appreciate it. You all have all been a very patient and very kind audience. Thank you for the very nice questions. Again, Hetero Healthcare for the wonderful arrangements. I think there's a nice warm lunch awaiting all of you all. So I won't keep you all from it. I look forward to seeing you all in the second, third, fourth, fifth, sixth modules, all the way to 12 modules. The plan is one per month. We'll see how it goes. And you know, thank you very much. Have a good rest of your day.
Okay, good afternoon once again. I think there is a good song coming to my mind that Dil Abhi Bhara Nahi. So yes, I think a lot of questions we have, and as Dr. Sitesh Roy sir said that this is just 2 modules. Again, we will be meeting. My team will come to you and meet you for the coming modules, probably specialty wise, because that is the what we are planning. So now I'll request Dr. Prashant Khandeparkar sir to felicitate Dr. Sitesh Roy. Thank you. I think Dr. Sitesh Roy sir already shared that lunch is ready. Thank you once again from Hetero Healthcare to come and join us at different. I thank you all the delegates at Kohinoor Hotel and even our Satka residency. Let's have lunch together and we'll depart with a note that we'll meet again for the second module or third and fourth module. I'm sorry. Thank you.